Hi, how are you? This is Damaris Maria Grossman, and this is the Mindfully Integrative Show. And today we have a mindful chat with Margaret Romero. She's a functional medicine nurse practitioner, and I cannot wait for you guys to meet her. She has written a book and many of things to tell you about her story and her lupus to living. And I've read her book and I've also known that she has so much information and I follow her for many years now. So I'm so excited that you've been on the show and you had some time. I know that your time is precious. So thanks for coming on.
Thank you so much for having me.
I appreciate it. So as I kind of start out, I just ask people, what's a little fun fact that people may not know about you?
Well, if you're not following me on Instagram, I love to cook. That is the one thing. It nourishes my soul on many levels to cook. And I'm the type of cook that I really don't measure anything. Ideas come into my mind. I just create it. I don't necessarily need a recipe. So that's a little fact about me.
Do you like to cook?
Oh gosh, I can cook
What's your like favorite dish?
almost anything. Um, I make this crispy chicken that I love. It's so good. It's crispy chicken, and then I'll make it with. I love cooking veggies. I love cooking like stir fries with tons of veg. So that those are probably my two biggest go-to. But I can certainly cook like Italian or Thai, um, almost anything.
Totally
Almost
random, but
anything.
what's your favorite spice?
Mm, okay, well, I get my spices typically from a place called Savory Spice, and I learned about them when I was living in Boulder, Colorado, and they have a particular blend that I put on almost everything.
Oh, nice. Okay. Savory
Yeah,
spice. All right. I'll have to
Savory
look that up.
Spice. Yeah, it says it's oh my gosh, it's escaping me the name.
If you have a
But it
link
has
for it, I'll
yes,
well, if
all
it's
right,
on
I'll
your
let you
website,
know.
I'll tell people to
It's
reach you out on
perfect
that.
for so many things. And it's
For
got
cooking.
rosemary in it, so it has, some
Ooh,
antiviral properties to it as well.
love it. Okay. So just a like a I love spices, so just was wondering if you had a particular one
Yes.
you had in
Well,
mind.
if I had to pick like one thing, it would probably be
Mhm.
rosemary.
Rosemary is yours? Okay.
Mm.
I like oh, that's a good one. Yeah. My husband likes thyme. I like turmeric, pumpkin spice, oregano. I know. Depends who I'm
Mm. They're
Um,
also
all
good.
right. So tell us a little bit about your story. I was excited when I got to read your book a few years ago and I went actually kind of went back and looked over some items because my functional medicine journey as I'm learning and I know that you had years of experience with lupus and I'd love for those to talk for you to talk more about that or whatever you'd like to share for the audience too because I know that someone needs to hear your story and how you're and also you're a nurse practitioner so you're providing and a functional medicine provider so you're doing all the work.
Yeah. So end of 2006, I started to have some symptoms. It started really small, just joint pain, like a wrist would hurt, and then a week or two would pass, and then the knee would bother me, and then it started to progressively get worse, and then it would be more joints, and it would last longer, and it just progressed to this full blown thing really, really quickly. And so I was diagnosed with lupus nephritis. At the time, I was living in New Mexico, and I was hospitalized and all of that. It it progressed so rapidly that I had not only painful joints but muscles. It was hard for me to walk, and because it became so hard to walk, finally, I mean, it like everything kind of like hit the fan one day, and I was taken to the hospital. My boyfriend at the time took me to the hospital. It wasn't like an ambulance thing, and that's a whole like it could be made into like a
A movie.
docu series.
I bet.
So from there, it was, I was actually medi flighted from one hospital to another and then flown back to the East Coast, um, to Boston, where I was hospitalized again. And then, kidney biopsy and tons of prednisone and all of these meds and 20 meds a day. At the same time, I'm still like in so much pain, gained so much weight from the prednisone, just like 30 pounds. Hair was just like, you would do this and it would just come out. I would wake up in the morning, there would be hair all over my pillowcase. And I ended up having multi-organ involvement. So I had pleurisy, my heart was enlarged, my liver functions were elevated, lung, muscles, joints, all everything. And so from that, I decided, that was a crisis, right? I was in crisis. And
Definitely say that
so,
would be crisis, almost near death,
right,
almost near death.
yes. I mean, it was like, I don't know what would have happened to me if I wasn't taken to the hospital that day. Like, I don't know, probably, who knows? But um, from there, I was on meds for about a year or less, and of the heavy duty ones. But about 1 to 2 weeks after my hospitalization, I started to notice, or even sooner, I started to notice that my joints would get swollen and red and painful after each meal. And so from there, I was like, maybe I have celiac disease. Like, what's going on? And so went to my rheumatologist. I asked her, I was like, look, I want to get a DNA test. I want to find out if I have celiac. And she's like, save your money. Don't worry about it. Just like take your medicine. And after that, that pissed me off so much that I went ahead, I did my own DNA test, comes back to non celiac gluten
Gluten
sensitive
sensitivity,
genes,
yeah.
and then became gluten free like almost immediately. Learned everything I could, got books out, bought books, read everything online. And then I literally 7 to 10 days after being gluten free, I started to notice a decline in my pain, decline in my joint pain. And I was like, oh my God, this is amazing. I'm going to figure this out because no one could ever answer why. Why did this happen to me? I don't understand. I mean, I was working a lot at the time, like 70-hour weeks, working through weekends, working 7 days a week for really no reason. So um, I worked a ton. And from that point on, I also learned to like not work that much. Not because I need to, because my body will break down if I do now. If I needed to, let's just say, I could, but I choose not to work that hard anymore because why? Because we all need rest, we all need sleep, we all need downtime. So um, from there, I completely started testing for every single thing, did my own blood work checked my hormones, nutrient levels, did stool testing, everything. I did all the functional tests. And now at this point, I will tell you that I was not at all like 100% in functional medicine. I was not. I was doing more holistic, more integrative,
Yeah,
holistic.
yeah, yeah.
And so
Kind of where I was
autoimmune,
like teeter tottering. I'm like in that like now a couple years in, but yeah, I what you're saying. Now you're
yeah,
really in. Yeah, yeah.
yeah. And so lupus was not my focus, autoimmune was not my focus, and now
Right.
is. But so I did all the tests. I uncovered so much stuff. It was unbelievable, the things that they never considered or thought of doing. And I did it all. Was taking supplements. I got rid of, um, you know, any pathogens that were in my gut. I balanced my gut microbiome as much as I could. There was a lot that went into it. And lo and behold, after all these years, there are no longer traces of ANA or anti-DNA in my body. If you tested it, everything comes back negative. So I have zero symptoms of lupus anymore. And
That's profound. I mean, I want people to hear that. You know what I mean? I, as I talk more and more to other functional medicine providers and those that are really getting what you put in your body, that's profound. I mean,
mm,
how many people just say that lupus is not curable at all, or at least not manageable?
oh my gosh, I
Right?
mean,
How
listen,
often is that conversation said? I mean, all autoimmune is not manageable. And I think that what you're, I mean, you were like on your deathbed.
Right. And coming out of that and to where I am today, which I go to the beach, I have sun exposure. I mean, there isn't anything that I don't do because of my health. I'm back. I feel like I'm back to normal, actually, probably even better than what I was before lupus, which was not, I'm not saying that it was, I was in bad health then, but I was definitely like a little overweight, like ate like crap, I just, I wasn't, I was not gluten free, which I am now. I drank whenever I wanted. We went out like 2, 3 times a week. It was like margaritas. I lived in New Mexico, so margaritas are like a thing. And now I wouldn't even think about drinking that much. If anything, like a month could go by, and if I don't go out anywhere, I don't drink at home. And so, maybe a cocktail or two in a month, literally.
But but you're even more mindful probably. I mean, I noticed for me when I started to shift, like different kinds of shifts, but specifically in that functional medicine change or my food conversation. Even with alcohol, you probably still are like, all right, you probably are very specific on what you drink and how much and stuff. So,
Oh
and all the
God.
foods that you eat. I mean, gluten free. When I started to go gluten free, I'm not even having a lupus situation. I just realized the benefits of it after, and I said, I can do this. This isn't as hard as I thought. And then I went dairy free and like, okay. So, talk
Yeah.
to us a little bit more. I mean, of course, if you'd like to talk more in your book or just your practice as a provider, because I know that I mean, I say the show is integrative, but it's really kind of changing your mindset and integrating this traditional point and then trying to, for you, it's a shift. So if you want to talk more about that
My shift my shift from functional, I mean, conventional to
from
functional.
conventional to, yeah, kind of, I mean, or what, however you'd like to describe your story.
Well, so I mean, definitely conventional medicine trained. But my specialty was more emergency medicine, trauma. So there, I wasn't daily like writing scripts for Pepsid or, omeprazole or Lipitor or what have you. So that was never my thing. I went from emergency to working like some family practice, but it was never. It was more like an urgent care setting, so suturing and things like that. So it wasn't that hard to make that transition. But um, what I do now, like even on Instagram, which is where I hang out every day, is I just try to show people and teach people that, listen, a biologic is not necessarily like the end all be all. It's just like rheumatologists are taught a certain way. One is that they believe that we don't know why autoimmunity happens. Number two, we don't know how to get rid of it. And these are like BS because we do know what causes it and it does go away. And also, in order to handle a autoimmunity, it is not about like just huge band-aids and just like let's suppress everything. Um, that's like it's craziness to me to think that this is what currently medical schools are being taught like every single day. This is rheumatologists are like graduating, they're specializing in this, and this is what they're still teaching to this day. When um I mean, I'm not the only person that's gone from lupus to living, literally. And I know another nurse
You're
practitioner.
definitely not, but I think that your story is super profound though. Like you went from like near death. You're not just like going, all right, I had an autoimmune. You're like, you've had severe
I was, oh,
inflammatory. You know what I mean? So you're
horrible.
talking about this like near death experience and it's not hairy, airy fairy. You did the work and the time and you come out and wrote about it and you work and see patients. I think that it's really important for people to hear it and to understand how
Thank
important that is.
you. Yes, I mean, it's so important because we're so trained to also like give our power. You give your power to your doctor because they know everything and they're God and everything they say. And then, oh, biologic, okay. Oh, okay, more prednisone.
Or
Okay.
prednisone, right?
It's like, no, 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 no. How about why don't we talk about what's at the end of your fork? Number one. Why don't we talk about
The
the junk
water?
food that you're eating? Yeah.
Like, what are you
Well,
eating?
right. The water, how much soda are you drinking? How much sugar are you consuming per day? Let's talk about this stuff because listen, what you feed your body is what your body will produce for you. If you, I mean, I don't know. It just, I guess people don't really think about it. Like, you cannot feed your body McDonald's 4 or 5 days a week and expect it to be at its most optimal. And for you to be and your organs and your labs and your blood and everything to be like superior, it just can't happen. It just not going to happen. And so the more people consume things that are toxic, or even use products at home that are toxic, anything from like Febreze, like chemicals. They're spraying this all over their furniture, like all over everything, like in the air. And then you have like your kid and your toddler like walking around and smelling this stuff. It's insane to me. It really is.
I can only imagine like the how you feel on about like, well, just talking about, would you, I mean, your story itself is a lot. Would you like to go and or discuss something further, either patient or discuss more about kind of your key elements, or not even just things that you've used for yourself, like a one thing. You don't have to go in ever all detail because I
There's
want
a
people to
huge
reach you.
thing. Yes, there is the biggest thing that nobody ever looks at, that I think is crucial. It is the missing one out of a few missing pieces is having a stool test. Now, I will give you an example. This week, one of my patients, we reviewed, she had a stool test done. And she said, "Oh, I said, it's really important for you to get this stool test." She had lupus. She has lupus. And she's like, "Well, my doctor, I'm doing stool testing with him, the LabCorp." And I was like, I just, no, that is will not show us much. I promise you. Um, but she already had it done, and I was like, okay, get it done. It's fine. Whatever makes you feel good. But we need to do mine because it gives me 6 pages worth of information that no LabCorp quest will ever compare or match. And so she gets it done. And let me tell you, her test was like negative, 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 negative parasites, negative H. pylori, all of that. And it was only like maybe 4 or 5 things that were done, like cryptosporidium and crypto parasites, ONP, just like a few of the like basics. And my test comes back positive Giardia, positive H. pylori. Like it picks
Wow.
it up. It picks it up because listen, I can, even in my book, I'm like, get stool testing. And then I think people will just kind of go to their
Like,
GI and be like, "Can we do a
completely
stool
agree with
test?"
you. I completely agree with you.
I
But
got a
no,
stool.
but I think it's such an important conversation.
Totally. It is the thing because look, I don't care if you change your whole diet and you're gluten free and you eat kale every day. I'm sorry, but if you have a parasite, you'll never get better because parasites, if you have one parasite, you have hundreds. And so, and then you're gonna just further decline because no one looks in the gut ever, ever, ever. And then they're like, "Oh, you're still not feeling better? Let's okay, how about this biologic? Let's just put you on 40 milligrams of prednisone or 60 milligrams of prednisone. Let's just dampen everything. Let's just kill your immune system, and then
Give you so
maybe
much
you'll start feeling
protonics
better then."
and more protonics and more omeprazole.
Right, right. And then do you know what happens to the parasite? Parasite that no one's discovered, and now you're weak and you're immunocompromised from all this medication. That parasite flourishes because your body is not fighting it. It's not capable of doing anything. It can't do a thing against that parasite. So you worsen, more meds are given. It's like this vicious cycle. And so I'll have people come in and tell me, "Oh, but even on Instagram, they'll send me messages. I stopped gluten. I stopped gluten and I didn't feel any better because gluten is not the only thing. There's toxins, there's heavy metals, there's so many things. How are you eating? You know, sometimes people do need to go through a detox. But not every detox is good for everybody. And also, when you do a detox is also really, really important. You can't just be very weak and very ill and try to do a detox. No, your body will not do well. And so what I do is I remove what I can with supplements, like get rid of that parasite or giardia, right? Build up your reserves, put you on supplements, figure out what else is going on very slowly, depending on the person's condition, of course. And then when you're just up, you know, more stable, then we can start talking about detox. So there's many steps, many factors, and everyone's triggers are very different.
Appreciate when you're saying that because you hear the detox thing or the cleanse thing, go on a cleanse, you'll be better. Um, and you don't even think about that like you're like, oh, that'll fix it or something. Or some people will say, oh, I went on a cleanse, I should be okay. And then they start eating bad again or whatever. But then they're also already immune compromised. So that's an interesting point because I don't think that I think people are like, oh, I'm just gonna juice for a couple of days, I'll be okay. And you're like, oh God. And
Right, right. And so the there's so many levels to this. I had so
no,
many
you can
problems
just
saying
you can
this.
talk a little bit more, however you like to do that. So
No,
go for it.
no, from what you just said about the detox. So, yes, first of all, there's many detoxes, but the thing is that people don't realize when they just sort of randomly go on this detox or that detox is how open are your detox pathways. You won't know that unless you get tested. And if you're constipated, forget it. Do not do a detox because you will only get worse because all those toxins will just recirculate
Cities.
and you will not get better. You'll get worse. So don't even do that. So the thing is, if someone is constipated, get the stool test. We need to resolve that. You need to be going to the bathroom like
Regular.
once to twice a day, minimum. Yeah.
Yeah. Wow. Well, how can those reach you? But first off, do you have anything that you'd like to share additional that's coming up or that because I know you have done so much. You have your own podcast. Would you like to talk about that also?
Yeah. So I have a podcast called the Sacred Medicine Podcast. I come out with one every week, roughly. Sometimes I'll, over the holidays, I won't do one or something, but I have that. Let's see, that's been about 3 years that I've had that.
That's great. 3 years. That's a lot. I've only been doing this for about a year. So
Yeah, was it or is it going to be 4 years? So I think it's almost 4 years actually.
very
So
dedicated. Excellent.
it's there's so much work that goes into it. Oh my goodness. Um, and
I'm
so
learning that.
we talk about functional medicine. It's primarily for women, and we also talk about women's health issues that I find that so my audience tends to be around 30 to 50, roughly, are the ages. And so everything is natural approaches to everything. Any illness or what have you, we're talking about it. So I've got some I got someone coming on about depression and how to deal with it, naturally. Nothing on the podcast is about what medication is the best to take for this. It's not about that. It's all about
Good.
how to heal with functional medicine and also dealing with trauma is really important as well. I had to include that in there.
Such a great point. I mean, so necessary. I was listening to a few of your podcasts, so I really want people to follow you and listen to your podcasts in addition to reading your book. But I really that's how I found you was from your podcast. And then
Oh,
also we're nurse practitioners, and I was like, oh, she's a nurse practitioner. Oh, wonderful. So I was like, oh, we resonate. And then when I found out you were a functional medicine provider too, I was like, wow, this is amazing. So I was like, I was at one point, I put the intention out a few years back that I was going to meet you, but I didn't know when. So I was like, I don't know if you're
Oh,
ever
wow.
into intention, but about a few years back, it's like when I wrote your book, it's like I'm hoping to, touch base with her at some point, and
Yeah.
so it'll unfold at one point. So I'm so glad to finally get to have you on the show. And I mean, just the podcast, but to actually meet you. So I guess in person is how they is now, how life is now. But maybe in person at one point.
Of course. Yeah. I think you're right over the bridge, right? Aren't
Yeah,
you in Jersey? Yeah.
exactly, exactly. So, no, I really, I think that's like really important because I think women's health in general needs to be discussed. Anything in the natural area, people need to talk more about it. I mean, and then I
For
mean, that's
sure.
why I kind of started this podcast because I just wanted people to start having a conversation of like, what are you doing differently? Like, let's start, you know, doing something different.
Yeah.
Um, and how can those get a hold of you and reach out to you? Or do you have one little takeaway right before, we go into that? Because I'll have all of your information in the show notes.
Okay, so I have, my regular website, margaretromero.com. I've got the podcast. I have the book, which is on Amazon, and there's a Kindle version as well. And I hang out on Instagram every single day, and most likely you will catch me, cooking. I love to cook. I love, you know, the topic food as medicine. I think that rings true for me for sure. I mean, being gluten
Have like
free.
a cookbook probably eventually.
Yes.
I
Yeah,
could see it.
yeah, I already have like a book this thick of like my recipes. And so I don't think it'll be that hard to just kind of gather them, put them in a book. So,
Cool.
um,
Looking forward to it.
yeah. And also, people DM me. And so I love when people DM me. And I answer my own DMs. I don't pay anyone to like answer my DMs. So if anyone has any questions or if they're, anything, they can totally reach out and DM me on Instagram. I mean, and you could have like a few years ago too.
And you're taking on new clients too, because you're a nurse practitioner, family medicine practitioner. So not only with your, but you are taking on new clients at this time too. So that,
Yes,
okay,
yes.
perfect. All right,
So
great.
women with chronic illness, thyroid issues, lupus, any autoimmune condition, fibromyalgia, chronic fatigue syndrome, things like that. Things where you've been told there is no cure. That's the type of women that I see. Yeah,
And only told to go to one specialist that'll give you a band-aid fix.
exactly. And if you're tired, because you know what? I was on 20 pills a day and I
Oh
still
my
felt
gosh.
horrible at that time, like way back way when in the day. Um, 20 pills every day and just you would just I mean, I couldn't even look at myself in the mirror. Literally sitting there, hair is like so I mean, I went from like this to almost nothing and I had to cut my hair pixie cut. Like, pixie cut, like totally short
Yeah, yeah. Oh
hairstyle.
my God, I'm so not good. I just have to put my hair up, but if I have it too short, my curls will just be a mess. Oh,
So well, I don't even know what I was getting at
but
there,
you're saying
but
like your hair, like you were saying, like you had so much
oh, yes.
medication, you had to cut your hair, you were just a mess, and that
I was a hot
you
mess,
knew that
hot
you
mess of
wanted,
stress.
like not in a like negative, but you needed to change your life.
You would think, I mean, here's 20 pills to take. Okay, well, it
Needles is
didn't
a
do
lot.
anything. It did nothing. I could barely walk up and down stairs because I just hurt. Like even walking, like every single joint in my feet, I could feel like just stepping out of bed and just putting my feet on the ground. I was like, oh, it was just such a bad time in my life. My God. And I know what that feels like. And the fact that women still continue to feel that way, that bothers me so much, which is why I do the work I do, because I'm like, I want to give hope to people like, hey, all right, hold on a second. Like, we can reverse this. So, yeah, that's what I want people to know. It
No,
is
I
reversible.
can't wait for those to reach out to you because I think that you have such a wealth of knowledge, just such beyond, n- from your own personal experience, but how many people you've helped and how you're changing the medical field and that just a new mindset. It's a different way of thinking, and we need to think like this more often. And so more and more people that I can have on like you and others, it's very passionate for me and very inspiring. So I just really
Yeah.
appreciate you taking the time. And I just want to verify again. It's and just reiterate. It's margaretromero.com. And what are the other websites how that can reach you and your book?
So once you go on to my website, you can access the podcast from there. But on iTunes, I'm on iTunes and Google Play and all the places, Spotify.
Yep.
And that's the Sacred Medicine Podcast. And then Instagram, it's under my name, Margaret Romero.
And your book and the name of your book?
Is From Flare to Fabulous, 25 Things You Must Do to Avoid Your Next Lupus Flare.
Awesome. I loved it. So I want people to
Oh,
take a
thank you.
listen. Yeah, it's really well written and just a lot of just direct information to exactly what people need. So thank you so much for your time
Oh my
and
gosh,
I
thank
appreciate
you.
it.
It
And
was
I
a
look
pleasure.
forward, yeah, I look forward to bringing more people to you and then, some of my patients to you and us working at some point together. So thank you so much for your
For
time
sure.
and those listening, thanks again.